what are the characteristics that go into a really good drug developer?
The most important thing is
you cannot do it alone. Quite frankly, an ego that can work together.
Part the ego or embrace the ego?
I think both.
Welcome to Leading Beyond the Lab. Today I have the pleasure of being accompanied by Melinda Merchant and Rachel Humphrey.
I used to say I have this team of people who have decades of experience and tons of successes, and they check their egos at the door, but I actually decided that ego is not a bad thing.
So with Normunity, what allowed you to build this company?
Lieping Chen is an engine of targets. He's a deeply experienced student of the immune system and has, over the course of his career, identified
new method or new approaches to treat the cancer.
The most notable is he identified PD-L1, a vital part of the PD pathway. We've done a really great job of identifying which we can use to build new medicines. One of them, the world has not identified similar proteins before, will be entering the clinic and treating patients within the next few months. It's called
Welcome to Leading Beyond the Lab, Series 3. Today I have the pleasure of being accompanied by Melinda Merchant and Rachel Humphrey, two pioneers of immuno-oncology. They've got a wealth of experience from academic and in the clinic through to industry, proven leaders in drug development in big pharma and biotech. Welcome, it's a pleasure to have you on here today.
Thanks so much for having us.
Thank you.
I'd like to hand it over to you both to give a little bit of a snapshot into your journey and take us through that.
Do you want to start?
No, you go ahead.
Melinda Merchant, I'm a physician scientist. I trained in immunology as a PhD and had the pleasure of training in pediatric hematology and oncology at NCI and Hopkins in labs of such IO pioneers as Crystal Makel, interacting with Steve Rosenberg, and spent the first half of my career as a PI, clinical and laboratory scientist, and physician seeing patients with difficult to treat tumors that we were working on bringing new therapies to. About halfway through that career, which included some time at Memorial Sloan Kettering, I ended up making the move to industry. Went to big pharma first at AstraZeneca, and then have spent some time in biotech. So I've gotten to see a whole field, but really from the very beginning, the purpose has always been bringing new, more effective treatments and therapies to patients who have both rare and common but difficult problems to deal with in the oncology space.
That's great. So my story, I'm a medical oncologist trained at Hopkins and in internal medicine and at NCI for my oncology fellowship, and then stayed on some extra years on faculty. I joined industry in 1997, where I supervised the development of sorafenib at Bayer, among other drugs. I moved to BMS, where I built the immuno-oncology department from the beginning. Ipilimumab is my second baby, Yervoy. I've got lots of babies. Ask my kids. These drugs sat at the table at dinner time, you can imagine. Absolutely did. I went to AstraZeneca, where I built the immuno-oncology department there as well, was chief medical officer of multiple small biotechs before I became the chief executive officer at a company called Normunity. Throughout my training, Hopkins, NIH, and then into industry, the goal was to try to make a difference for as many patients as possible. I always say that I think the reason why immunology and immuno-oncology was particularly interesting is I am at that age group in internal medicine where most of my medical training at Hopkins was in AIDS patients, where I could appreciate the interface between the immune system and cancer, and then just took that forward into my pharmaceutical career.
That's brilliant. I'd love to dive into a little bit about how your paths crossed.
Multiple times. Melinda, go ahead, tell the story.
Interestingly, we weave through each other. Rachel mentioned ipilimumab. I was a PI on the pediatric trial. The first pediatric trial of an immune checkpoint was within Rachel's program. I worked directly with another medical director, but interestingly, both of my very good mentors and bosses within industry were from that program. So Rachel was, as you heard, the head of IO there. And Susan Galbraith was also part of that team that I met at an initial, it was early 2000s at that point. We didn't actually cross paths at AstraZeneca, but we did again at another biotech back in, it was around pandemic era.
Yeah, right, 2021, 2022.
So we crossed paths, and a recruiter said, Melinda, do you know Rachel Humphrey? She's looking for somebody to partner with her in the clinical development of a unique way to reach rare, unmet need for patients that aren't, whose EGFR mutations or changes were not being met by the drugs out there at the time. And so that was the hook. And I remember us talking then about, this isn't exactly IO, but it is meeting some of our other plans. Is there an interaction? Is there a rationale within there that fits in with the scope of both of our visions? And the answer was yes, and we could go into that, but the more interesting part is we learned to work well together. Mm-hmm. Rachel as a CMO, myself as a VP of clinical development there. And about a year after she left that company, she said, Melinda, I've got an opportunity at Normunity. We're building something unique. I think it's right up your alley. I'd love to have you come and be the chief medical officer here. And that was really how we ended up being this team for the last almost 3 years. I've been there almost 3 years now at Normunity.
Yeah, and we've worked together since that first company. I would say it's 5 years.
So the foundations were laid then?
Absolutely.
Correct.
Well, I think the foundations were laid. It's important to say because you could hear our training and our exposure has been very similar. We're both at the NIH, not necessarily at the same time, exposure to industry and some of the same companies, same drugs, same time of the world where the science of oncology is exploding. We could use our academic work that's thoughtfully and similarly established to continue to work together.
And similar passion. I hope that's
Agreed.
coming out in our conversation too.
Definitely. So what was the inflection
We love
point?
this job. This is good.
What was the inflection point where you both thought, you know what, I want to do this in industry? I'd love to see how similar or different they are.
You went relatively early, so your path is a bit different.
Yeah. So it's very interesting. I always thought, my husband and I met in college. And so we went to college, medical school, residency, fellowship. We have the same CV for all intents and purposes.
Did the kids go into medicine?
They said, "Are you kidding?"
I'm always interested by that when there's two parents that are.
Well, my son said, "I don't want to be a doctor because you guys work too hard." But he's a specialty physical therapist, taking care of patients in a way his parents never did.
Yeah.
So in fact, I think he went in the direction we went, but on his own terms.
Yeah. He's
which
still a healer.
I love. He's still a healer.
Yeah.
That's exactly right. But what I would say is because Jeff and I were in the same academic space, in 1997, we consciously worried that the two of us would be competing with each other for roles. So we headed to the pharmaceutical industry because it was wide open for creative scientists. And we thought that we could each blaze our own path without getting in each other's way. And that proved to be exactly right.
Yeah.
We were also very supportive of each other. So we went early, even though we had always thought we would stay in academics, that proved complicated for a husband-wife team.
Yeah, and I suppose there's less roles in general.
Especially
Without
now.
moving,
I think we got it right probably. Although we made that transition with a little bit of apprehension, we were very worried that we were leaving something important to go into an unknown space whose true nature we didn't get. I can tell you that for both Jeff and I, our academic lives took off. Our impact on the world took off. And the transition to large and small pharma for both of us turned out to be exactly the right thing.
And how does that compare with you, Melinda?
So for me, I spent the first 12 to 15 years of my career in academics at NCI, Memorial Sloan Kettering, and then back at NCI. And that gave me a bit of a protected environment to really be working with the patient very closely. I would go up to the operating room and bring stuff right back to the lab and really do that translation. So for me, there's a lot of excitement at that interface between science and medicine. In fact, I went to my physician scientist program thinking that they were very much the same language. But what I've learned through my career is that word translation is right. It really does go from one concept to another. And there are different skill sets that are needed in that development. And I got to a point in doing that in the academic world that it wasn't moving along fast enough. And I knew there were things I didn't know about drug development. I'd sat at that really early phase and done a lot of pilot things, been part of things like ipilimumab and other targeted drugs, not together, and putting that precision medicine and immuno-oncology in a space that it could really move along faster is quite frankly what industry does better than academia. And so it was another one of those calls. I would get them regularly. Do you have a fellow that's getting ready to graduate that would be good for this role?
Yeah.
And I remember talking to my networking partner at the time, and I said, we haven't trained a fellow like that in a really long time, but, honestly, since me. It kind of actually sounds like me. Tell me a little bit more. And so that became a bit of a conversation, and there were actually enough NCI diaspora within the world that I was headed to, right? That basically made me feel comfortable enough that this was a worthwhile move. There is confidence, there is learning to be had, there is impact to be made. And I think sometimes in academia, we think about it, or we're maybe taught about it as it's the dark side, right? People joke about that, but there's an underlying truth to what they're saying when they say that. In reality, I don't see that. And I see industry as something that we learn well as physicians. You cannot do it alone. There is a multidisciplinary team that is necessary for patient care. And there is certainly a multidisciplinary team that is necessary for drug development. And they are not the exact same, but when you get them and overlap them well, it can be really exciting. And I'll just go back to Normunity, because with Rachel, it's actually the first time I've had an MD as a CEO.
Yeah.
And a female as a CEO. And it may be one or the other, but definitely those two additive synergistic properties have made a perfect partner for me in my first step, in my first role as a chief medical officer, that I think gets to the root of, if we ever stopped learning and being able to grow, it would be boring and not worth doing. But there are so many patients with needs out there that it is worth doing. It is worth the hard work. And I think it took both sides of that career for me to get to the space where I am and being able to make that kind of a difference.
Yeah, and on your point about the dark side, to use the Star Wars annotation, I find or feel like that is slowly fading away. Would you agree? Because 5 years ago I was still getting that, and I was still having that term thrown at me sometimes. But now I'm slowly seeing it start to disappear, even though there is probably a hidden underlying tone.
I do agree, and I think the Boston area does it well.
Yeah.
There is an entrepreneurship
Definitely.
to not only the professional training here, but all layers of it. We moved here when my daughter was in elementary school, and there was an entrepreneurial ship to the type of learning that they were doing that I did not see. She was in a great public school system where we came from, but it's just a bit of an outlook of, hey, this is actually the way to move things along. And those kind of partnerships, and you see them here in Boston and Cambridge quite regularly, they are what help that ecosystem for each of us to continue to be growing in successes.
There's definitely a dynamism in Boston, especially. It's like the epitome of it, really.
Well, I think in the world at large, especially following COVID, it's pretty clear that the biotech and pharmaceutical industry is creating important contributions to science. But there's always a tension there. I learned the other day of a young college student who's actually interning in our lab in New Haven, who is majoring in biotech.
Really?
Yes. And she's doing the internship in our lab in part as part of her learning. So I think that suggests that there are certainly young people who recognize that biotech is itself a dynamic opportunity to make contributions. I think there's a role, obviously, for academics and for biotech and for pharma. But I agree with you that the relationship between those two institutions appears to be strengthening.
Yeah.
And the notion that it's okay to build new medicines in an environment that is more business-like than academic is definitely softening.
And with that in mind, what advice would you give to physicians that are potentially listening to this podcast that are thinking, I've thought about it, I'm considering it, but I don't really know what it's like? Like, what's the thought process they have that goes behind actually making that decision?
Well, all I can say is, having lived at Hopkins and the NIH, two very strong academic environments, and then years in industry, I do not look back with 1 ounce of regret. My career took off in the pharmaceutical setting. My contribution to the world took off. And I would say to anybody, do not be afraid. This is awesome. Opportunities abound. And your lives will be enriched with fabulous science and opportunity.
Fabulousness.
It's all fabulous. It's absolutely all fabulous.
And what traits go into a really good drug developer? What are the characteristics that you think that they should take into account?
So I'll say a few things, and then I know Melinda has lots of great ideas too. But what I would say is the most important thing for a great pharmaceutical career is resilience and creativity. And I think that's true for any career, frankly, in medicine, because the world is changing in lots of ways. But if you can flexibly look at your opportunities and pay attention to where the science is going, and just keep your ear to the ground, you'll do just fine. That's how I would say.
I think the opportunity to ask questions, to be creative, to put yourself in spaces that maybe aren't the most comfortable are key criteria that are necessary for success in either academia or industry. That understanding of how they go together, again, another interface that can be fraught with worry, but can be fraught with opportunity. To be able to see the opportunity in challenges, and to be able to have the kind of quite frankly, an ego that can work together as a teamwork to make things happen.
Do you part the ego or embrace the ego?
I think both.
Yeah.
I used to say I love the clinical team we've assembled, and I will say I think part of our success at Normunity was started from day one with founder and employee number one in Rachel. She put a lot of thought into the team. And the team that was assembled both before I got there and since I've got there is really purposeful in how we interact, in how we support each other. And I used to say I have this team of people who have decades and tons of experience and tons of successes, and they check their egos at the door, and we get work done very collaboratively. But I actually decided that was the wrong way to be looking at it, because ego is not a bad thing, and they certainly, all of them, have reason to have that ego. They have built that confidence and that expertise. And quite frankly, in the world today, we probably need to pay more attention to expertise and give a little bit more respect to it. That ego doesn't have to be checked. So that ego doesn't have to be checked to come in and work together, but you have to know how to work in a dynamic as a team together to be able to have that joint success.
And how does that link to leadership? Because you've both led people and teams in each of the big three kind of environments, whether it's academia, big pharma, biotech. What's the secret sauce there?
The fundamental secret to success, I don't know. I don't want to play it, but this is how I see it. A good leader listens carefully to their team. Melinda is brilliant, creative, thoughtful, and I see my job as kicking the cans out of her way. Obviously, I've done her job before, so giving her guidance into what I've seen, the pattern recognition I've come to appreciate is super important. And I've been in this rodeo before. I've watched that activity go in that direction, but use your judgment in the context of all the time and energy you've put in. And I think that's what works at Normunity. I do my best to stay out of everyone's way and to make sure that behind the scenes, any obstacles I might perceive as potentially obstructing their path, I'm managing behind the scenes to move.
I think we've pulled together a team that's not just yes men and women.
Right? Oh yeah, right. Diversity of thought.
And the ability to say, no, let's think about it. What about if we think about it from this direction?
That's right.
And the ability to have those professional disagreements that don't hit the personal space, right?
Oh, yeah.
That there is a level of trust that pushing back at science or a concept, there's not a lot of things that are absolutely right and wrong when you're setting forward hypotheses in science. You love to get the killer experiment that gives you the exact right or wrong and the next path from that. But as you're thinking the vision and trying to share that vision with others, which I think is one of the key things of a leadership and that Rachel does so well, you have to be able to have some of that, okay, maybe my first thought needs some development and growth, and that ability to think and challenge it together and grow it into something more than we even envisioned when we first went after Norm 823. The way that it can land and the possibilities for what it can address keep expanding as you keep asking those questions that themselves generate more growth questions.
Yeah, I think the most important series of questions is, or moments, and we have tons of them at Normunity. One person will say, I wouldn't do it that way. And the other person would say, tell me more about why.
Yeah.
Period. That's it.
And you have deeper and deeper.
And then when the dialogue is done, even though there are people in the room who may not agree with where we've landed, and I, by the way, love to leave a room with a different opinion than I came in with. So we shape it together. At the end of that dialogue, when we all agree, I think we have a direction, you leave that room with one voice. That requires trust, which is vital. Trust that everyone's been heard, that everybody's concerns have been at least acknowledged, if not addressed.
Yeah.
But there is nobody in the room, not from the youngest intern to the most senior person, who can't say, that's not how I would do it. And everybody will hear, tell me more about what you worry about.
What's the record for how long that's taken? How long have you been in the room for? Is it like deciding the Pope sometimes?
No. Well, first of all, at Normunity, and Melinda said this, pretty much everyone around the room in positions of seniority are deeply, deeply experienced. And so we've all been through this rodeo before in one way or another. So I would say it doesn't take weeks. Sometimes it's a few hours. It depends on how thorny the question. But I'll tell you, some challenges need to be studied. They need to be iterated. And in a diverse and healthy environment, you have individuals who have different ways of digesting a problem. Some of them can digest it quickly. Some of them take more time. And so you have to allow for that diversity of processing, but at some point you have to make a choice, and that at the end of the day is my responsibility to say, we've heard all angles. I think we're beginning to spin here. This is what we're going to do. And in a healthy environment, everybody feels like the dialogue was the right one, and we're going in the direction we have to, even if not everybody agrees.
I do feel like there's something to be said for getting to a point where everyone understands everyone else, and then just sleeping on it.
That's
and revisiting it like the next day, because I think your brain processes things. And I know I've gone to bed with one mindset and woken up and thought, do you know what, they're right. When I actually think that through and park my ego and really embrace what everyone's saying, I'm in full alignment.
Sometimes you don't realize they're right or wrong except in retrospect.
Yeah.
So I think the most important thing is to recognize that we don't always get it right. Sometimes it doesn't feel right in the moment. But true leadership and innovation, especially in a fast-moving biotech space, means taking risks that aren't always wrapped up in a tight and neat bow when you make your choices, and then being ready to look back and say we did the best we could with the information we had and see how it goes.
And in biotech, you often have outside pressures that are driving when your time limit for talking through those things
Exactly
are.
right. If you're paying close attention, that's exactly right. It's a complicated space.
Or at least a commute. So the labs are down in New Haven as a Yale spin out, and our development offices are up here in Boston. So you asked how long those conversations can last. Some of the best conversations are
during the
when
commute.
We're either in the commute together or talking during the commute through the commute.
Because you're fully with each other and present, aren't you, on the commute?
That's it.
Exactly.
I find. There's the lady that set up the spandex company. That's what she does, doesn't she? I wish I knew her name, but the billionaire.
She does it all in the commute.
She calls it her commute thinking time. And she basically has 30 minutes, and she lives, I think, 5 minutes from the office, but she takes a 25-minute detour, and she doesn't put the music on, and she just processes everything. And she says the best decisions have come out of that. I find that quite interesting.
How sensible.
Yeah.
Well,
very sensible.
We try to go down. I go down every Tuesday.
Yeah.
And some of us go down every other Tuesday, and we try to go down together. And that 2.5 hours in the car can be amazing thinking time as a team. And even if we're not in the same car, we can often put the phone calls together. And connect
them.
Anyway. That's it. Exactly right. Yep.
So with Normunity, in a super competitive incubator that is Boston, in a super competitive space, what would you say, in your words, is the unique value proposition or compelling scientific story behind what allowed you to build this company? Well,
there are a handful of things, and we've touched upon them in some ways, but I'm going to focus on the science. Lieping Chen is an engine of targets at Yale. He's a deeply experienced student of the immune system, and has, over the course of his career, identified a number of important tumor proteins that have served as backbones for successful oncology programs. The most notable is he identified PD-L1, which is a vital part of the PD pathway that serves as the basis for pembrolizumab, nivolumab, and other anti-cancer immunotherapies. So the original plan for Normunity was to use Lieping's science to build medicines around. And early on, as we built a lab right next door to his, the two groups have done a really beautiful job of learning from each other within the context of their spaces. The academics are asking conventional academic questions about what do these proteins do for a living, and the pharmaceutical team the biotech team is looking to understand how to leverage those findings to build new medicines. The early years of Normunity, we were figuring that out, but at this point, 4 years in, I think we've done a really great job of identifying which among Lieping's new proteins we can use to build new medicines. And one of them, which we're not revealing the name of the target, it's called Target 1, has some very special properties that I think the world has not identified similar proteins before, in that this particular target is not on most normal tissues. It's homogeneously expressed, and we've been able to build T-cell engagers, ADCs, radioligands against this target.
Oh, really?
We'll be entering the clinic with our first lead program, that's the T-cell engager Norm-823. We'll be entering the clinic and treating patients within the next few months, actually.
Exciting.
And the other agents against that target are making their way through the pipeline, looking very promising preclinically.
When I walk around your offices, one of the things that stands out is definitely culture. What do you think is behind that?
Well, we touched on a lot of this earlier today,
Yeah.
And I think the question is timely in the context of the one I just answered, because an environment where all questions are welcome, all dialogue is robust and thoughtful and egoless, we can challenge ourselves to do things that others have not done before, and watch the company grow where everybody around the table can see their contribution. It's not top down or bottom up. It's a wonderful collaborative environment where all of us are making a contribution to something that may very well change the world.
So what's the next big milestone? Is it the trial?
It's Melinda's milestone.
So it's that interface between science and the clinic. We are moving into the clinic, submitting the IND, and being able to do that first patient in and treat them with Norm-823.
How you celebrate when that comes in?
with sleep.
We're not getting much before then, but
It's a mixture of amazing feelings.
Yeah,
I imagine.
no,
Relief,
no.
happiness, fulfillment. Enrichment was a great one that you used earlier, actually. That stuck with me.
That's it. But actually, I have to say, we celebrate all the time. It gets to the culture. We try to do lunch together as a team,
Yeah.
at least once a week.
I know.
We celebrate our times together. We feel very good about what we're doing. So I would say it's a joyful place to work.
there's purposeful gratitude,
Right.
creativity,
Right.
an interest in being together, whether that's in the same room or, remote. But that shared purpose really does help drive a difference, I think.
And is there any secret sources or mindsets when it comes to the translational side, particularly you, Melinda, have a lot of expertise in, that you would like to share?
I think there is a need for both creativity and really careful design so that whatever answer you get, it helps drive the next steps. You're not creating dead ends or work just to check a box. You're actually trying to show early in that step into clinic that you're hitting your target, that it is doing the things that you thought, that the things that actually maybe the scientific models, as good as they can be, they're just models.
Yeah.
That clinic, the human vivarium, actually can teach you some things, and you can learn science off that if you are purposeful in asking those questions that therefore feed back into it. It is not a one-way line from lab into clinic into commercial. There is actually a feedback loop to keep making things iteratively better and to listen. And I think that's one of the ways that I take my kind of split career, as we've talked about. My time as a principal investigator, a PI in academia, very much influences how I like to design and set up the team. It is a collaborative effort that I could not do without the PIs and their research teams and their clinical care teams to be able to do what we as a company would like to be doing with this drug development. And that, quite frankly, it's a very regulated environment, what we are required to be doing as sponsors. So meeting those sponsor obligations, meeting that obligation to think about the patient and their time and energies, we need to be good stewards of all of that. And in the C-suite role, being good stewards of the investment that's been given us to be doing this. And so that, again, is very iterative, is a problem-solving step by step that with your key stakeholders may look slightly different in how you're talking about it. But that transparency and ability to see, here's a challenge, where is the opportunity, is a good thing to underlie almost every single interaction that you have.
I think it's important to understand how Melinda does her job, as I see it anyway, which is really amazing. And this is also helpful for those academic or physicians, scientists or physicians who are wondering about what happens in pharma. Every choice we make about the design of a program is done with deep reading and understanding of the available science. We're not working in a vacuum. Melinda does a phenomenal job of scouring the available literature, staying in touch and on the pulse of what's happening in real time, so that the work that she does with her team is done in the context of the broader evolving understanding in a meticulous and thoughtful way.
Well put. That's very well put.
And when I mentor others in that move, there is a decent amount of what I also get from Rachel is, let me tell you the movie that's playing in my head. Sometimes that is let me tell you about, in retrospect, something that I might have made a little bit different decision on, and what I learned from that process, and maybe you can learn without having to go through that exact situation. And so that also speeds it up. So applying that to the given step in front of you is very important as well.
Amazing. One final question. I'm conscious of time. How do you, Rachel, juggle being a CEO of a biotech alongside being the lead singer of a famous band like the Checkpoints with Jim Allen?
Well, first of all, it's a great question. I'll tell you
World
why.
tours next.
Yeah, that's right. No, we have a gig next week. It's
nice.
There's actually a second band called the Czech Pints. No, seriously, the Czech Pints are playing next week, and the Czech Points played 2 weeks ago. Let me just say to everybody, please maintain your hobbies, is all I have to say. Because I can tell you that when I go to ASCO or SITSI or AACR, it's the time I spend with the band that's as important, if not more important, than the time I spend in the science. And those two parts of our lives are of vital importance. I think they iterate on each other. The bands actually talk science at rehearsal. We share each other's experiments to the extent we can. So I view them as infinitely.
In that band, right?
Yeah, well, there's a lot of in 2007 we were just junior folks in the world. Now the guy who plays the piano on the Checkpoints is the CEO of Moffitt. Yeah. So there's lots, and one of them won a Nobel Prize. So I mean, we've come a long way. Jim Allison. But anyway.
Sorry, Jim Allison.
There you go.
Yeah, and there must be something to be said for the creative juices flowing with music, right? I imagine.
Absolutely.
We do run into lots of people who are both scientists and musicians. I think the creativity feeds and utilizes both sides of your brain and helps you to think outside of this is how we've done it always, this is the limit of what we can do, and expand beyond that. Isn't that what we're all trying to do?
Absolutely. I learned the other day that the consultant that's helping me with business development is also the lead singer of his own band out in California. And the other day he came to a Zoom meeting with his hands covered in fake tats. And I thought, I've never seen tats on Jack before, but he's as creative outside work as inside, and I gotta give it to him. It's awesome.
Was that just to get into the mindset?
Yeah, no. When he's got a gig, he covers his arms with tats.
He goes for it.
He goes for it, and you know what? It is awesome. It's awesome.
And if anyone wants to reach out to you, what do you suggest? What advice?
Well, absolutely write to us on LinkedIn. I pay very close attention to LinkedIn. Mm-hmm. By the way, I say yes to anybody who asks me to connect, even if their name is in non-English characters, because I think it's important to be part of the world and do this together. Yeah.
And you've got a story
always
to share.
Willing to connect and mentor and help.
Absolutely.
Well, thank you very much for joining me on the podcast today. It's been an absolute pleasure to have you both.
Thank you for having us.
Thank you.
It's great.